NABN, New Africa Broadcasting Network.
Welcome to Doctors in the House. Today we have an exciting show for you. Dr. Nelson Aluja, who is a board-certified internal medicine doctor and pediatrician here in Newark, New Jersey, is our guest. He's the immediate past president of the New Jersey Medical Association. He is also assistant professor of medicine at the New Jersey Medical School, Rutgers University. He's also on staff at the Newark Beth Israel Medical Center. Welcome, Dr. Aluja.
Thank you, Dr. Baker. It's a pleasure to be here.
I want to thank you for coming by today to be with us. We have some questions as we come into the Christmas holiday about the SARS-CoV-2 pandemic and all that we're hearing about the Delta variant and now the Omicron variant, which, as you know, was first discovered in South Africa back on November the 24th of just this year. And these mutants, both Delta and Omicron, have been causing a lot of concern among Americans and around the world. What's your perception of the influence of the Omicron variant? How concerned should Americans and Africans, Europeans, how concerned should we be about this variant?
Well, once again, thank you for having me. It's a pleasure. No doubt, the Omicron variant, it's a variant of concern. As you all know, we've had mutations all through, from the original variant that came out of Wuhan, and then there's Alpha, the Delta, and now we have the Omicron. Viruses do mutate. That's what they do in order to survive and propagate and pass on their DNA, just like you and I will pass our DNA to our children. We change our environment so that we can survive, but they can't change their environment. What they do, they change their DNA or the RNA so that they can survive. So as they do that, so that one, they escape the vaccines or escape the immunity of the individual, at the same time increase their effectivity as well as severity of the disease that they cause so that they can survive. So with the case of the Omicron, like you said, got identified. People tend to say discovered in South Africa. I don't like to use that word. I say identified because originally we don't know where this virus was originally from. But the South Africans were really smart enough. They've got great surveillance system, which they've displayed, identified it, and they were decent and professional enough to let the world know that this is what we have, and that the world should be careful. Ideally, at this time, they should not be castigated upon that to a point where it's become an appetite, a travel appetite for the rest of South African countries. The concern they have, yes, it was very concerning because the initial study did show that there were about 50 mutations on this virus, and that on the spike protein alone, there are about 32 mutations on the spike, and on the receptor, there are about 10. So, of course, when you see that, it was very concerning, and they had no idea what some of those mutations would mean. And that's the reason why a lot of the time you heard most people say, oh, we need to wait for 2 weeks to truly understand and evaluate this virus so that they know how effective it is and how the severity of the disease it would cause. So that's why. The world was so concerned. I mean, there's a story behind the whole,
yes,
COVID-19. We see the devastation it did across the world. So once you have and then what the Delta did, which is still the predominant variant here in the United States, but we didn't want that to happen with the Omicron, so they had to take precaution. It's not just the politics of it because it came out of Africa, but then it's something that's very concerning.
Yes, and I think you have identified that perhaps one of the best surveillance systems in the world actually comes from the South Africans. Even recently, United States scientists admitted that their surveillance system was not as good as and had not been investing as much money
Right.
into surveillance here in the United States for new variants. So yes, I agree with you that we should recommend congratulations to the South African scientists who do have a very top-notch surveillance system.
Right.
Now, as we go forward, we're now about 2 weeks into recognizing this new variant known as Omicron. And still, Delta is still the primary variant in most
United
places
States.
around the world, although England believes that by the end of the year that Omicron could actually become the primary variant. During the holidays, as Americans, Europeans, Africans plan to travel, what type of precautions should they take with Omicron? Is it anything different that they should do?
Well, the reports that we get, and of course with the mutations that they've identified, shows that it's very, very infective. I think there's a report that actually said there was about 500% higher than the original virus that came out of Wuhan, and about 4 times, more effective than the Delta. So, of course, and some of my friends and colleagues that I have in South Africa are reporting in a family of 10, 6 people are getting infected. So, and almost everybody's getting infected. So, it's something that during this holiday, as people travel with the infectivity of Omicron, that this can spread really far. But what would I say? Thank God that the severity of the disease hasn't been as bad as was expected. I guess there could be a couple of reasons why. Mind you, that the original variant that came out of Wuhan did not really affect Africans per se. If you remember, the number of deaths in Nigeria, across Africa, is nothing compared to what you have here in the Western world. So, and again, I can't overemphasize the need to get vaccinated. Like I always say, in the Western world, we don't hear about polio. We don't see polio no more. We don't see measles. We hardly see, chicken pox. That's a reason for it. The reason because most people here, over 95% or 98% of the populace here in the United States, are vaccinated against those things. So everybody's basically immune, and even if people come from outside the country with those viruses, they hardly get infected. So for us to truly curb or stop this virus, like we've done every other one, polio, smallpox and all that, is for us to all get vaccinated. The difference then, in 1918, when the very first, pandemic took place, and now is technology. We have the technology to be able to stop this virus. Remember, vaccines only came back late 1940s and the early 50s, where things got better. So the virus, the flu virus, gave us almost a 50-year head start. From when it came up. So we didn't have the technology we have now, and thank God we have the mRNA technology, which is even much better than what we've had so far.
Yes.
So those are the things that will help stop this virus. And like you said, hopefully it's the end of the pandemic. But you know what viruses do? They mutate.
They mutate. Yes. Talk to me about testing. You're talking to me about technology. When we first started back in the fall of 2019, the spring of 2020, our testing was evolving, and our testing was not very good, in my opinion.
Right.
But now testing has really come a long ways. What would you recommend for someone who is sick with a cough, cold, runny nose, isn't sure whether they have a common cold or whether they have influenza,
Right.
or whether they have the Omicron virus? In terms of testing, what would be your recommendation?
Well, as we go from the fall to the winter seasons, this is where everybody's indoors. And of course, viruses tend to spread more during the winter period. And like you said, you have the flu virus, which is still around and still kills about 30,000 people every year in the United States. And people need to know that. That's why they need to get the vaccines. You have the RSV, respiratory syncytial virus. You have the human metapneumoviruses that look like RSV. So all of these viruses are around. And of course, you now have the Delta variant and God forbid the Omicron on top of it all. So far, we've been able to, all the viruses I just, highlighted, we have the technology to identify and detect them. So far, the Omicron is being picked up by the viruses, the testing, kits that we have. They really do. But when you screen for COVID-19, it tells you positive or negative. It doesn't tell you you have Omicron unless you go back and do some analysis of the DNA, the RNA variations, and that's what it'll tell you. Reports did show that it's easy to actually identify if it's an Omicron virus, because unlike the other way, it lights up in 3 ends. The Omicron lights up really quickly in 2 ends, and that's why they're able to identify quickly and run genetic analysis on it. So yes. But for the everyday man and female, the best steps is to do the PCR test.
Yes.
That will tell you if it's COVID-19 or not.
Very good. Now, as a pediatrician and as an internal medicine physician, you see a broad spectrum. You really see from birth to the grave, so to speak, in your practice. And we're recommending vaccinations now, starting as young as, I think,
7?
Yes, 7 years of age. Some people are even suggesting a future of down to 4. But let's say from 7 years all the way until 100 years old or older should get the vaccine. There's been a lot of news about potential dangers of the vaccine. What are your thoughts about the dangers versus the benefits?
Well, again, with everything else, it's risk and benefits. I'll give you an analogy. There's a huge risk of driving a car, but the benefits far outweighs the risk, right? So, I mean, if you're coming at me at 60 miles an hour and going, we're just a few, meters apart from each other, and that's a huge risk. But the benefits far outweighs the risk. Now, the benefits of getting the vaccine so far outweighs the risk of what we get from the vaccines. Again, are there risks? Yes, they're risk with everything else. Like I always say, everything is not good for everybody. First, you sit with your doctor, discuss what your clinical situation is and the signs and symptoms and your pre-morbid clinical state that you have, so that you come up with an ideal plan for you and the best vaccine that you should take.
Yes.
And the precautions that you need to take when you get the vaccines. There have been reports of few, blood clots here and there, initially with the AstraZeneca and the Johnson & Johnson. Very few cases that have been out with the, Pfizer. And there have been cases of Bell's palsy with this. But, it hasn't really been correlated yet, because we still have, hard number of people with Bell's palsy that come up every day that's not related to COVID-19. So
Yes.
there are a few risks. Yes.
So vaccination, really, whether you're in an African nation listening to this show, or whether you're here in America listening to this show, or in Europe, where many of our viewers will be listening, vaccination really is the gold standard.
It is the key.
It's part of the way forward.
It's
part of the path forward.
It's the way. I mean, I can foresee a place where this will be given to 6-month-olds, like we do with the flu vaccine. They'll give it to 6 months old. They'll do the first initial dose, like we do with the vaccine, the flu. Half a dose at 6 months, and a month after they'll give the second dose. Because again, that's where you begin right from the onset. Begin to protect kids who would eventually live on with this virus 100 years from now.
Yes.
I think it's time that the whole world come together and sit and really come to a table and discuss how best to handle this disease, this virus, so that we'll all be safe and we'll all be protected.
Yeah, and I think that's the takeaway message today, is that the nations of the world must come together and come up with a plan that works, including widespread vaccination of all the nations.
Right.
All
That's
54
the word, the
nations
key
of
word.
Africa, but
Yes.
all the nations of the world, not just Africa.
I had written that before. No one is safe until everybody is safe. So the rest of the Western world have to put that money down to vaccinate not just Africa alone,
Right.
but Asian countries as well that haven't had vaccination.
You are correct. Well, it's been a pleasure, Doctor, for you to be with us today. Thanks for taking time out of your busy schedule, Dr. Aluja, to be with us. This is Terrence Baker, host of NABNTV, Doctors in the House. Thank you for joining us. We look forward to seeing you soon. If you have questions, suggestions, you can reach us at info@nabntv.com. Thank you.
NABNTV, inspiring a new generation.